Please speak to your general care physician about any questions about your health. This video is and has been prepared as an informational guide, not in any form given as medical advice. It is important and advised to speak with your medical team for proper diagnosis. The team at Kidney Conversation makes no claim to be medical professionals, nor are we trained in the medical field. This video, along with all materials associated with this video, are our own experiences and created with research on multiple platforms. Again, it is recommended and advised by Kidney Conversations to seek medical advice from a trained medical professional.
Hey guys, welcome to Kidney Conversations, and I'm your host, Jonathan Traylor, host of Hope with Jonathan.
And I'm Kyle Hawkridge, founder of KWM.
And today's, guys, we asked the question, what is kidney disease?
So guys, today we're going to take you over to our website where we have an in-depth overview of what is kidney disease. We're going to pull it up, and you can always head over to www.kidneyconversations.info, click on the blog, and you'll be able to see the full blog on that page looking like this right here in front of you.
Yep. And so today, guys, we're again answering the question, what is kidney disease? And so we're going to click on this blog here and enter our website at kidneyconversations.info. So guys, what is kidney disease? And here's an overview for you. So kidney failure is a medical condition that occurs when your kidneys fail to perform their vital function. This causes an accumulation of waste and blood that eventually causes organ failure and death if not treated. And so many of you out there may be asking, what is a kidney? Basically, the kidneys are two small bean-shaped organs, one located on the left, one located on the right sides of the spine in the middle of the back. Each are responsible for maintaining normal balance in the body. They help with the production of red blood cells, the main organ for removal of excess fluid from the body and regulation of blood pressures. The kidneys perform over 300 functions per day. So they are a very vital part of the body.
Yeah, one of the key functions of the kidneys is the elimination of certain waste products from the blood. This is vital. This is the vital function, and it is one they perform in order to keep us healthy. When the kidneys remove the extra water and waste products from our bodies, it is passed on to the bladder and expelled through the urinary system.
That's right. So now we're going to talk a little bit about chronic kidney disease. And although it's not always caused by kidney damage, chronic kidney disease is the progressive decline in kidney function over time. With kidney disease, generally, there are no symptom, signs, or treatment options. That many have it without knowing because their symptoms are kept under control with medications. Generally, patients are faced with one of two types of kidney failure, chronic and acute. Here are some forms of CKD.
So many patients that visit us and follow us may have one of these symptoms, one of these diseases. I know the first one that we're looking at is polycystic kidney disease, and that is what my wife Shannon has. A quick overview of that disease is where the kidneys develop cysts all over it, eventually strangling the kidney. It's a genetic disease that can be passed on from one parent to the child.
Yeah, polycystic kidney disease is usually transferred from handed down, through DNA. From what they're finding, a lot of patients end up with polycystic kidney disease that are, they're usually family members. Multiple family members end up having it. I know that you said Shannon suffered with polycystic kidney disease, but I actually suffered with chronic kidney disease, and it was related to my diabetes. And so we're going to talk just for a second about CKD. So this is the most common form is CKD, chronic kidney disease. It affects around 150 million people around the world, and it causes up to 60% of those with liver disease to be diagnosed with chronic kidney disease. The symptoms that come with CKD nephropathy include loss of appetite, fatigue, thirst, and increased urination. I had a few of those symptoms. I had definitely had the loss of appetite, fatigue. So I definitely had those. Due to this, if someone has the symptoms like this, they may be diagnosed with CKD, and eventually, you'll end up going through kidney failure and be a candidate, eventually for a kidney transplant. That's the best form of treatment when you're dealing with CKD.
Yeah, and then we know and understand that there's IgAN and many other forms. You can have kidney disease related to lupus. This is just a general overview, and if you stay connected with Kidney Conversations, our goal is to touch on every aspect of kidney disease, not just this
Right.
is just a general overview.
Right.
But acute kidney disease can be found in someone that had an accident, falling off a ladder, a car accident, someone with severe dehydration, an infection. There's different forms of acute kidney disease. They can usually be managed by medication. In other cases, surgery is necessary or even dialysis in some patients.
Right. And AKI or acute kidney injury disease, some situations where people are involved in an accident, maybe you're in a car accident, and it causes sometimes a little bit of damage to the kidneys, and sometimes they suffer with that, and then they have to do dialysis for a while until the kidneys can heal or repair. And then if they don't, then the option at that point is to stay on dialysis. But guys, there's some different stages also of kidney failure. Once you get diagnosed with kidney disease, no matter what form it is, kidney disease is broken down into 5 stages. You starting from 1 to 5, each stage progressing to total kidney failure. The 5 stages of chronic kidney disease are defined by the amount of protein present in the urine, or proteinuria.
Yeah. So someone at stage 1 has less than 90% kidney function. Stage 2 is 89 to 60% of kidney function. Stage 3 has actually been broken up into stage 3A and stage 3B, but it's basically 59 to 30% of kidney function. Stage 4 is 29 to 15% of kidney function. And then stage 5 is 14% or less, and that's declared as end-stage renal disease. And most patients at that 14% will begin to be on dialysis or searching for kidney transplant.
Right. And a lot of patients that are walking around with kidney disease don't know that they have it. So therefore, they end up getting diagnosed. A large percentage of them find out around stage 3.
Yeah,
So,
and that's one reason that we're here with you, educating, so you can try and catch it as quickly as possible.
right. And a simple blood test and urinalysis can detect early signs and symptoms of kidney disease. But before we get it and talk any further about that, we're going to go into symptoms of actual kidney failure that maybe you've been experiencing and you don't even know you have it. So let's go ahead and talk about a few of these symptoms right here. So symptoms associated with kidney disease vary at each stage. Also, in patients suffering with CKD, those suffering with CKD do not always exhibit the same set of symptoms. Some of the more common symptoms of those suffering from CKD are as follow. Okay. So like I said, Please speak with your general care physician about any questions regarding your health. And again, guys, in no way, shape, or form is this a diagnosis, but some of the symptoms of kidney failure and kidney disease can be high blood pressure, definitely blood pressure that just cannot be controlled very well. Nausea, just can't keep your appetite. You get sick to your stomach easily, vomiting, loss of appetite, all those pretty much go hand in hand. Fatigue, it can become very chronic fatigue where you're just sleeping all the time. That's the next one, sleep problems. Sometimes some people have insomnia where they stay up all night, can't sleep, or they're just sleeping all day due to the chronic fatigue. Urinating more or less, you may notice that you're not urinating enough. Decreased mental sharpness, brain fog, if you will. Just kind of sometimes being in deep thought or maybe loss of thought. Maybe someone's talking to you and you just kind of float off, or maybe you become real forgetful. Muscle cramps, yep, I experienced those as well, the AKA Charlie horse. I had those a lot especially in my legs. Swelling of feet and ankles, I definitely experienced those. My feet, I had what was called almost like cankles, where my legs were running right into my ankles with all the swelling that I had. Dry, itchy skin is another sign of it. Shortness of breath, especially if the fluid builds up on your lungs. I experienced that as well. It's a very scary situation. Chest pain if fluid builds up around the lining of the heart.
So, if you're experiencing any of these, we highly recommend that you go speak to your GP, general practitioner, your family doctor, and let them know what you're feeling, him or her know what you're feeling. And then there's a couple of tests that they can run, especially if kidney disease is in your family. It's
Right.
something that I would recommend on your yearly physical, starting to it's in your blood test, your yearly blood test, um, that they can do. And what they will be looking for is I'm going to butcher this word, glomerular filtration rate, or GFR, as it will be known. And that is basically a number that your doctor will use. It's EGFR, estimated GFR,
Mm-hmm.
and that'll tell the doctor how well your kidneys are functioning based upon the toxins left in your blood.
Right.
Very simple blood test can tell you someone with polycystic kidney disease or an acute kidney injury or a CAT scan, MRI, ultrasound.
Yep.
And also they can do a urine analysis to see how much toxins are passing through. So the
Right.
tests are very uninvasive, and just a little jab in the arm, withdraw some blood, and they can tell how your kidneys are functioning.
Right. Yeah. And then what happens is once you get diagnosed, once they determine that you have kidney disease, eventually they'll probably get you in contact with, and it looks like the next step is a renal diet, where they want you to talk and discuss with possibly a renal dietitian to help slow down the progression of the disease. Also, they'll probably talk with you about some medications that they may want to try as well. But eventually, you may end up getting to a point where you experience what's called, kidney failure. And then you're going to have to end up being on dialysis. So now we're going to discuss, treatments of kidney disease.
Well, I think actually, Jonathan, the first treatment would be you're going to be referred to a doctor, and a kidney doctor is a nephrologist.
Right.
So that would probably be the first step. Your family doctor, after
Yes.
seeing your results, will
Yep.
send you off to a nephrologist. So if you hear the word nephrology, that's a kidney doctor.
Exactly. And so if your general practitioner or your primary care physician detects that you have kidney disease, and it's going to be a progressive form, definitely going to have you follow up right away. Definitely, if they detect that you have kidney disease, directly to a nephrologist. And of course, the nephrologist is going to want to run their own blood work as well and do a urine analysis and see exactly where you're at. They're definitely going to be looking at that EGFR that Kyle was discussing, also your creatinine level. to see exactly where you're at and what stage you're at. But these are some of the forms of treatment that they will probably discuss with you. I'd already mentioned talking with a renal diet. A renal diet is a special diet for those with CKD that they need to follow. If you have any kind of kidney disease or if you are on dialysis, diet plays a critical role in the treatment of kidney failure. And the renal diet has two components. The first is to reduce your intake of high protein foods, which are the main culprit in progression of kidney disease. The second is to increase the intake of low protein food in order to help your kidneys in their work. I will add a little bit to this. If you go into kidney failure, complete kidney failure, and you're on dialysis, they'll probably reverse this a little bit and want you to eat a little bit more protein because your kidneys aren't functioning properly and not, able to get rid of the toxins properly and filter out the blood, and therefore your muscles are going to start breaking down, and you need that extra protein at that point to help aid to this.
So that's correct. On our main page, if you were to go back to the main page on kidneyconversations.info, you'll see a great video on the renal diet that was hosted on Hope with Jonathan. Recommend that you go take a look at that. Here on the next stage would be in kidney failure. You'll be put on dialysis, and basically dialysis is the cleaning of the blood and or body. In peritoneal dialysis, removing the toxins from your body.
Yeah.
So there's two types of dialysis. One is hemodialysis, and the other is peritoneal.
Right.
Peritoneal is the cavity, basically your stomach, and they fill that area with a fluid, removes the toxins, remove the fluid from your body.
Yep.
Some people get refilled. I mean, that's a very big topic to cover, but we'll get around to it.
Yeah, we plan on kind of expanding a little bit more on these topics. So we're just kind of briefly hitting a lot of these really quickly while we covered, what is kidney disease. But eventually, with kidney failure, if you're a candidate and, you do well with following the renal diet and you're getting a good cleanse with your dialysis treatment, and they feel like that you're a candidate for a kidney transplant, and you become eligible, they'll put you, in the system for that, and they'll refer you to a hospital. Your nephrologist usually does this, or your dialysis center. Usually it's nephrologist that writes the referral. And then you become eligible for kidney transplant. So basically a kidney transplant is a form of treatment where a kidney is transplanted from one human to another. This type of transplant can come from a living donor, meaning a friend or a family member, or even a complete stranger, aka altruistic donor. The donor would donate one of their good kidneys to a CKD patient, or any type of patient that's suffering with any disease that caused their kidneys to fail. A kidney transplant can also be done with the kidney of a recently deceased person, or a cadaver kidney, for those of you that refer to him as a cadaver kidney or a deceased donor, who has opted to be an organ donor upon their death. And there's other ways of doing this. There's a paired exchange. There's a voucher program. But kidney transplant, to me, is the best form of treatment for kidney failure.
Yeah. And as Jonathan was saying, kidney disease is such a deep topic, and we can't hit everything in an hour, never mind a day. Look forward to us providing more info. Continue watching the website, more blogs coming up every Friday. We have our video on a topic. If you have a topic idea that you would like to learn about, drop it in the comments and we'll be happy to cover that topic for you. But if you want to learn more about kidney disease, follow us on social media. And thank you for joining us, I guess.
Absolutely. Yeah. And don't forget to check us out, Facebook, Instagram, Twitter, and definitely refer right back to us right here at kidneyconversations.info.
And just like when you end Hope with Jonathan, thanks for joining us, and remember to take care of your kidneys.
That's right. God bless y'all. Have a great one.
Note: please speak to your general care physician about any questions about your health. This video is and has been prepared as an informational guide, not in any form given as medical advice. It is important and advised to speak with your medical team for proper diagnosis. The team at Kidney Conversation makes no claim to be medical professionals, nor are we trained in the medical field. This video, along with all materials associated with this video, are our own experiences and created with research on multiple platforms. Again, it is recommended and advised by Kidney Conversations to seek medical advice from a trained medical professional.